Good afternoon, colleagues. Good afternoon, all the invited guests, all those who have joined us via Zoom to this afternoon's session. It's the IIR, the Institute of International Relations, panel discussion on achieving the SDGs on health and climate change in the Caribbean, challenges and opportunities. And this topic couldn't be more relevant today as the region continues to face many of the challenges of climate change while we struggle with our own development needs in the area of health. And this afternoon, to join us in this conversation, we have an eminent panel of experts who will bring different perspectives to the issue of climate change and health. And we, from the beginning, would like to encourage all attendees, all the persons joining in, those from the region and those from outside of the region, to think about the issues of climate change and health and consider what questions you'd like to pose to our panelists. So this public panel discussion is one of several hosted by the Institute of International Relations as we continue our public engagement on matters of key importance to our region and wider field. And we know that we're joined by many of our former students of the Institute of International Relations, persons who are interested in the field of international relations, persons who have interacted in the past, both from the diplomatic corps as well as from academia, from the policy world, from NGOs. And we welcome you all. And we're happy that you're able to join us. You're part of the IIR family. And even with COVID, we are able to use the technology to link and put our minds together as we grapple with and provide solutions to many of the key issues of importance to our region. We're happy to invite you to put your questions in the chat. We have the chat function on Zoom. And when you do so, please remember to address your questions or comments to all panelists. So let me welcome our panel. Today we have Dr. Joy St. John, Executive Director of the Caribbean Public Health Agency. Welcome, Dr. St. John. We have Dr. Taraleen Malcolm, Advisor, NCDs and Mental Health, Pan American Health Organization. Welcome, Dr. Malcolm. We have Ms. Vashti Guyadeen, Chief Executive Officer of Trinidad and Tobago Coalition of Service Industries. Quite an avid and enthusiast on everything service industry related, and we're happy to have her on the panel. Welcome. And finally, last but certainly not least, we have Professor Donald Simeon. He wears many hats, but for now I'll introduce him as the Director of the Caribbean Health Health Center Systems Research and Development of the U.W.I. So welcome, Professor Simeon. I would, the plan for this afternoon's session is that each of our speakers will be able to make their presentation. I will introduce them just before that. We will follow their presentation with the following presentation. We'll have all four presentations, and unless there are any questions for clarification that we see in the chat, we'll then at the end of the presentations open the floor for a general discussion, incorporating both the questions from the chat as well as the questions and comments of the members of the panel as feedback to some of the other presentations that were made. So let me begin then by introducing Dr. Joy St. John. She has been the Executive Director of CARPHA, the Caribbean Public Health Agency, since 2019. And in that role, she provides leadership and direction to this regional agency, executing the functions set up or required by the Intergovernmental Agreement of the region. She is the first Barbadian to be the Assistant Director of the World Health Organization, a post that she held from October 2017 to April 2019. and she had direct responsibility for climate and other determinants of health. She was also the Chief Medical Officer of Barbados for over 12 years. She's also the chairman of the executive board of the World Health Organization and the first Caribbean person to do so. That's a post that she held 2012 to 2013. To be honest, Dr. St. John doesn't need too much of an introduction to anybody who knows about Caribbean and health issues. Her name is a household name in these forums. And we're so pleased to have her beginning this session on our panel today. So Dr. St. John, thank you once again, and over to you.
Thank you very much. Are you seeing my screen? Is it in slideshow?
Yes, we're seeing it, and it's in slideshow. Perfect.
Okay, so let me go back up to the top. And thank you so much for this opportunity to present on one of my favorite topics. This whole issue of health and climate change was an interest of mine even while I was Chief Medical Officer. And then I had the wonderful opportunity to have climate and other determinants of health as my portfolio when I was Assistant Director General at the World Health Organization. And my first slide is something that came up in my memories on Facebook this morning. It's something that I had posted a couple of years ago. And I thought it would be good to set the context of climate change and to let people know that the science has been around for over 100 years. This is a news clipping from August 14th, 1912. And in it, the author is saying that 2,000 million tons of coal were being burnt annually. And when it was burnt, it adds about 7,000 million tons of carbon dioxide to the atmosphere every year. And so this issue of climate change was long in the making. And the clipping ends off by saying the effect may be considerable in a few centuries. It's considerable in one. Oh my goodness, what happened? Let me share again. Sorry about that. So let us now go from a global historical perspective to a Caribbean perspective. And this is a poster from the country of Dominica, done by their environmental health department. And it's stating something that's also stated in the Paris Agreement on Climate Change, that it is the most important human health threat of the 21st century. So not only did WHO state this, but the Paris Agreement also had a considerable aspect which spoke to the threat to human health and the need to have interventions. So I'm now bringing it into the context of what are the milestones of action that have occurred in health and climate change in the Caribbean. And on my timeline, the first one that you see is the first International Climate Change and Health Conference in SIDS, which was convened by the Pan American Health Organization. And somewhere in between 2002 and 2005, there was the concept of having a climate change and health project, a global one. And Barbados was one of these 7 countries that participated in the climate change and health. It was while I was Chief Medical Officer. In 2004, with great foresight, the Caribbean Community Climate Change Center, known by us in CARICOM as 5Cs, was established. And so early on in the 2000s, the Caribbean mounted a specific organization to deal with climate change. In 2013, PAHO, 5Cs again, and U.W.I organized the Caribbean Climate Change and Human Health Workshop. In 2015, CARPHA and PAHO had a forum which brought Caribbean environmental health officers together in a conference. The countries reviewed the results of the Caribbean Cooperation in Health, which is our functional cooperation in health initiative, where all of the countries move together and improve the health conditions of the region. At that time, it was in phase 3, the third iteration. We are now in the fourth iteration, and the environmental health officers had an input into the fourth iteration and stated that climate change must be part of the continuing Caribbean cooperation in health. In 2018, under my direction, WHO created a SIDS initiative on health and climate change. I was directed by the current Director General, Dr. Tedros, to do an initiative for the small island developing states of the world. And we hosted 3 conferences, one in Mauritius, one in Fiji, and one in Grenada, where the ministers of health across the world indicated what were the specific outputs that they wanted that would help them with climate change and health. And then in 2019, CARPHA published a State of Public Health report with a focus on climate change and health. So climate change has been in focus in the Caribbean, supported by regional organizations for several years. So what is CARPHA's role? We do environmental monitoring, environmental assessments and auditing, emergency response, and one of the effects on climate change is the change in the way vectors both develop and affect humans through their transmission of disease. So we also have vector-borne disease management, more of that later. We have collaborated with PAHO and CIMH, Caribbean Institute for Meteorology and Hydrology, in a health climatic bulletin up until February 2020 when the pandemic derailed it. But what we used to do was to make predictions of climatic issues which would have effect on health. And you'll see some of the things there. The dry season, the issue of drought, potential crop damage, causing food insecurity, and of course, increased humidity promoting mold growth. And here you see the front page of the State of Public Health in the Caribbean, which was launched at the last Caribbean Health Research Conference that we were able to have before COVID derailed the Plan 2020. We have a virtual conference this year because COVID is still affecting travel and gatherings of many people. And here is a snapshot of the Caribbean Action Plan on Health and Climate Change coming out of the series of conferences that I told you about in 2018, where all of the small island developing states would have stated what their needs are for WHO and the regional organizations like PAHO to know how to plan and support the member states. So some critical actions that have been chosen by the health ministers of CARICOM include the idea of building regional relationships to address climate change and health, strengthening institutional capacity to analyze climate change and health data, and the implementation of regional public health communication, strengthening of regional technical capacity, and many, many more. But this whole issue of climate change and health is set in the context of the climate change activities and efforts. And here is an idea of how busy the climate change area is. On the left, the yellow box has the organizations working with climate change in the Caribbean region, and there are many, not just the ones who are represented here in this webinar, but also 5Cs that I would have spoken to you about, the CARICOM Implementation Agency for Crime and Security, CARDI, the Caribbean Agricultural Research and Development Institute, and many more. And we are guided by international agreements. You would have heard me speak of the Paris Agreement, but there's also the UN Framework Convention on Climate Change, which has been ratified by 197 countries, the Kyoto Protocol. But there are also regional frameworks, the region of the Americas and the sub-region of CARICOM, which include the Barbados Program of Action, the Samoa Pathway, the Lillandale Declaration, the Caribbean Cooperation in Health 4 that I would have told you about. And so there are several global, regional, and sub-regional frameworks under which work in climate health and climate change and health continue. So let's focus in on what is the funding for climate change and health initiatives. And we see here EU figures very largely. The EU CARIFORUM project, Strengthening Climate Resilient Health Systems, where PAHO is the lead, and there are several organizations supporting to the tune of 6.7 million euros. The EU Climate Project, again, managed by 5Cs, with 12 million euros focused on general climate resilience for many sectors. And the IDB Pilot Project for Climate Resilience through mitigation and adaptation strategies. And in this regard, CARPHA focuses on the health component, the generation of early warning systems for vector-borne diseases. But what of these vector-borne diseases? And again, EU is supporting the Zombie Project with an overall objective to improve public health of the Caribbean population through a reduction in morbidity associated with Zika and other mosquito-borne diseases. That's where the zombie comes from, Zika and other mosquito-borne diseases. So not only are we focusing on climate change and health and what can be mitigated, but we are also focusing on the outcomes from how climate change has affected health. And this is one of the best examples, this Zombie Project, to the tune of 5 million euros. But we could not have this discussion in the year 2021 and not talk about COVID-19. So here's a little snapshot, a likely theory behind the development of SARS-CoV-2, that there's a zoonotic crossover event between animals and humans that are in close proximity to each other because of habitat destruction, which signals a clear need for environmental and ecosystem preservation, and also the need for sustainable efforts for ecosystem preservation. And an actual project implementation response. What did COVID-19 do to our projects? Well, it slowed the rollout of project activities by restricting travel and in-country interventions. So COVID-19 not only was affected by climate change, but has affected our work on climate change. And human Financial resources were diverted from climate change work to management of the pandemic. So interventions have been reinitiated. We're trying to find new ways to work in this virtual world. And member states are working with collaborating regional agencies on advancing the health and climate change agenda. And Madam Chair, that is the end of my presentation.
Well, thank you very much, Dr. St. John. Perfect, on time, very clear. You addressed all of the key issues that we needed you to look at. So thank you very much for that. Welcome those who've recently joined our session. We're at the panel discussion on achieving the SDGs on health and climate change in the Caribbean. And we're looking at challenges and opportunities. I am Dr. Michelle Scobie. I'm the Acting Director of the Institute of International Relations. And my areas of specialization include environmental governance, global environmental governance, as well as international law. And Dr. St. John, you just touched on some of the core areas of the governance of health and climate change in the region, looking at all those regional partners. And I guess almost everything is affected in one way or the other by climate change. And that's probably a mammoth task to coordinate all of these agencies. And that's part of the task that you have. And it seems that you're doing it quite effectively with all your partner agencies. So thank you very much for that presentation. We're moving along to our second panelist in this afternoon's presentation. We're very happy to have Dr. Malcolm here with us, and she, as Dr. St. John, probably need very little introduction to a regional stakeholder. She's over 18 years of experience working in public health and development. Her areas of expertise include disaster preparedness and response, environmental public health, communicable diseases, non-communicable diseases, and the risk factors related to health and to mental health. Dr. Malcolm now works with the Pan American Health Organization, WHO, that's based in Trinidad and Tobago, country office. And there she holds the position of technical advisor for non-communicable diseases and mental health. And her responsibility is for the countries that include Trinidad and Tobago, Guyana, Suriname, the 6 Dutch Caribbean islands, Aruba, Bonaire, Curacao, St. Martin, St. Eustatius, and Sava. And we're happy to have Dr. Malcolm join us this afternoon to speak a bit about some of those international arrangements around climate change and health, and also who are the best partners that can work with us in the region, what funding, some of the issues also from her perspective that would be of relevance and important to the region. So once again, Dr. Malcolm, thank you very much for joining us on the panel this afternoon, and over to you. Dr. Malcolm, you're on mute right now. Sorry about that.
Thank you. Thank you. Thank you again, Dr. Scobie, for that introduction. And I'm very happy to follow after Dr. St. John's presentation, because she clearly outlined what is being done in the Caribbean region as it relates to the impact of climate change. She highlighted some of the impacts, but she also highlighted some of the actions that are being taken. And that laid the foundation for some of what I will present in my presentation. So first, given the fact that the title of my presentation is PAHO Role in the Regional Collaboration on Health and Climate Change, I think it's only fitting to start by first sharing a little about PAHO as an organization. And then I will give a brief overview of the impacts of climate change on health, because Dr. St. John clearly outlined some of those impacts. And as she also mentioned, it's not possible to be in a forum to speak about health in any aspect without mentioning COVID-19. So I will speak briefly to COVID-19 and the SDGs. Then I will go into the PAHO mandates on health and climate change, and then see how do we move from where we are. So the Pan American Health Organization is the specialized international health organization for the region of the Americas. And actually, it is the oldest international health agency in the world. It was founded in 1902, so it was founded before the World Health Organization. So therefore, PAHO wears two institutional hats. It's basically the specialized health agency for health for the inter-American system, but it's also served as a regional office for WHO, and that's why we always say PAHO WHO, and therefore we are part of the UN system. So the organization is guided by 5 core values: equity, which is striving for fairness and justice; excellence, which is achieving the highest quality; solidarity, which is promoting shared interests and responsibilities; respect, which is embracing the dignity and diversity of individuals, groups, and countries; and the integrity, which is assuring transparent, ethical, and accountable performance. And I think this leads us perfectly into a very profound quote by the PAHO director, Dr. Carissa Etienne. She stated that COVID-19 has demonstrated the vulnerabilities of all countries and the many inequities that exist. And these inequities relate not only to the health system, but also to the issues such as gender, ethnicity, geographic location, governance, food system, and housing. And that is the social, political, commercial, and the other determinants of health. And please note that the region of the Americas is one of the most inequitable regions in the world. So we all know that goal 3 of the SDG is seen as that health goal, but we also have the appreciation that there are several other goals and targets of the SDG that are linked to health. That also include our goal 13, which is climate action. So really, what have been some of the impacts and implication of COVID-19 on the SDGs? And Dr. St. John clearly outlined how it has impacted in terms of the implementation of the actions that needs to be done to tackle climate change and health. But in addition to that, we can all have that appreciation that there has been negative social and economic impact that will affect us in the short, long, and medium term, and at all levels, at the local level, at the national level, at the regional level, and of course at the global level. And again, it helps us to have this appreciation that the pandemic started as a health crisis, but has quickly become a human and economic crisis. And we have seen, and we can see that appreciation, how it will impact on the overall national development of countries. Again, what the COVID-19 has done, it has demonstrated the importance of all the SDGs to health, and of health to all the SDGs. So it really showed that need to have the health in all policies, ensuring that all policies, all programs that are being developed, health impacts and health implication must be taken into consideration. In addition to those, it have also challenged our health system. It has fractured our social protection and destabilized our economies, especially in the Caribbean, where we are so dependent on tourism. And it has also disproportionately impacted certain vulnerable groups, such as the poor, such as those with underlying condition, older persons, and of course, those that were already unable to fully access health. I will not go much into speaking about the overall climate change impact and health, but I just want to briefly mention some of these impacts. And the information on this slide was taken from the 2020 report of the Lancet Countdown on Health and Climate Change, based on some of the indicators that are tracked. And the report indicated that the change in climate has already produced considerable shift in the underlying social and environmental determinants of health at the global level. The indicators related to climate change impacts, exposures, and vulnerabilities are worsening, they are concerning, and they're often accelerating. So climate change is impacting on health, both directly and indirectly, and putting already vulnerable population at risk. And particular focus is now being given to look at the creation of indicators for mental health, because we can expect and we can have an appreciation that climate change is also impacting on mental health. So it is important for us to have appropriate indicators to be able to track and report on those impacts. So when we look in terms of PAHO agenda on health and climate change, we are guided by the Sustainable Health Agenda for the Americas 2018 to 2030. And this guiding document feeds into the development of the PAHO Strategic Plan 2020 to 2025. This is also guided by the WHO Global Strategy on Health, Environment, and Climate Change, from which PAHO have developed the agenda for the Americas for 2021 to 2030. So let's look now in more detail in terms of the PAHO agenda on health and climate change. So there are several areas that focus on, but the target of these areas is to build climate resilient health system, ensuring that our health system is able to withstand the shocks from the climate sensitive issues. And these areas focus on governance and institutional structures. We have areas looking at planning. We have the health infrastructure and services. So looking at the carbon emission assessment and mitigation and seeing how we can build our resilience within the health system. Importantly is the health surveillance system, ensuring that these climate sensitive diseases are being tracked and how that is integrated in the already established health system, but also being able to have those early warning system, which Dr. St. John mentioned, is being led by CARPHA. So we have those health co-benefits. We are able to assist countries to do the health co-benefits. We have been focusing a lot on capacity building, so equipping health professionals to be able to develop proposals and write a grant proposal in order to have funds to support some of the in-country's activities for health and climate change.
You have like 5 minutes left. Thank you.
Thank you. So in addition to that, we mentioned there are several mandates and action plans that are being developed, which I won't go into. And we have also assisted countries to develop their country profile for health and climate change. And just to give an example of one that was done for Trinidad and Tobago. So the PAHO Climate and Health in the Caribbean, the EU CARICOM project, which was mentioned by Dr. St. John as well, is based on 4 key areas: empowerment, evidence, implementation, and resources. So the CARICOM, the focus of this is strengthening climate resilient health system, and there are several countries of the CARICOM that is benefiting from this project. And there are several activities, including the National Climate Informed Disease Surveillance System and Modeling. And then we have with the Green Climate Fund, we have this project, the Green Climate Fund Readiness Proposal for 7 CARICOM countries. And included in this as well, there are several main activities. For the health infrastructure and services, the Plan of Action for Disaster Risk Reduction 2016 to 2021 shows that 77% of hospitals in the regions are located in areas of risk and required urgent remedial measures to protect personnel and patients. So PAHO have been providing support to countries, especially in terms of our flagship Smart Health Facility Initiative, which is building resilience of the health facilities to be able to withstand disasters during times of these disasters. So there are several existing and potential arrangements to support countries. Dr. St. John mentioned the CCH4. She also mentioned the Caribbean Action Plan on Climate Change. But I also wanted to share the example of how our region, in terms of the Caribbean, is also linking with other regions regionally. One example is through the 2021-2022 WHO event, which the SIDS Leaders for Health, and there will be a summit this year that provide that platform for leaders from SIDS, including the Caribbean, to be able to look at partnership and look at how collectively they can tackle some of these issues of climate change and health for small island developing states. Then there are several climate and health collaborating partners in the region, in the sub-region in terms of CARICOM and CARPHA. Then there are NGOs. Then we have the planetary hubs, which I am suspecting Professor Simeon may mention in his presentation. And then we also have our universities that we have to work with in order of developing the evidence to support some of the things that needs to be done. So in terms of the sustainable responses, the funding from PAHO to support climate change and health is predominantly being provided through the EU and the Green Climate Fund. But there are opportunities as it relates to our collaborating centers, as we can work with these collaborating centers to introduce novel and sustainable ideas. It's also critical for us to engage at the community level through the NGOs, through the faith-based organization, to get the community actively involved in advocacy as it relates to health and climate change. Then we focus on capacity building at national and subnational level, but we also have to look at how do we advocate for increased national budget for climate and health. So we must strengthen the interaction and agreement between government, civil society, and the private sector at the community level to formulate strategies with multiple actors and to support from broad sector of society in moving forward. So in spite of the pandemic, which we know have had economic devastation on countries, we can also see it as an opportunity. It reminds us that health is not a privilege, but health is a fundamental human rights. So we have to take advantage of the pandemic where health is being given such great focus and utilize that to advocate for more health and climate change initiative. Again, the importance of the One Health approach. We have to continue to look at the nexus between human and the environment, animals, and the climate. And we have to look at building back greener. And of course, using this opportunity to promote a more integrated approach to health, bolstering the environmental health of the pandemic to promote that integrated approach through air, water and sanitation, waste management, and safeguarding biodiversity to reduce that vulnerability to pandemic. So in closing, I also want to close with a quote from our director again, that PAHO remains unshakable in the commitment to the health of the peoples of the region of the Americas, leaving no one behind in the quest for universal health, reduction of inequities, and health for all. So I thank you for the invitation for PAHO to be part of this discussion, and I will hand back over to our moderator, Dr. Scobie.
Well, thank you, Dr. Malcolm. What an overview in 15 minutes. I think that after this, any of my students that needed to know about climate and health in the Caribbean, between what Dr. St. John said and you said, I think they're all ready. I can already give them full marks. So thank you very much for that presentation. It really gave a very succinct but complete overview of some of the key perspectives from the perspective of PAHO. It's quite interesting that you mentioned as well, which I think is one of your areas of specializations, the issues related to mental health. Now with climate change health plus the COVID, and your presentation as Dr. St. John as well was quite relevant, looking at some of the issues related to COVID and the regional work on climate change and health. I think particularly too, as one of the persons mentioned in the chat, the question of the One Health approach to policy, that it's one of the key areas of focus that you have as well. And it's very good to hear that. So thank you again, Dr. Malcolm. Can't wait for the question and answer session to discuss this some more. But now we turn to Ms. Vashti Guyadeen. We're very happy to have her here. She is the Chief Executive Officer of the Trinidad and Tobago Coalition of Service Industries. And Ms. Guyadeen has had more than 20 years experience in research and development, policy design, SME development, global and institutional competitiveness, and international relations. Before joining the TTCSI, she worked in academia, in the public and private sector, etc. She spearheaded many projects with international development agencies such as the Inter-American Development Bank, ECLAC, the World Bank, etc. And her concern related to issues of developing research products that enable the business community to make well-informed decisions is a concern that is well known, and it sets her apart in the service industries as one of those thinkers. And that's why we reached out to Ms. Guyadeen to share with us the perspective which you don't normally get, which is what does the private sector, the service sector, what's their approach to climate and health? To what extent those in the private sector are aware of this nexus, are managing the issues on the ground related to climate and health, and also what the industry is doing to address some of these issues. So very happy to have you with us in the panel this afternoon, and over to you, Ms. Guyadeen.
Thank you, Dr. Scooby. Good afternoon, ladies and gentlemen. Thank you for this opportunity. I am always happy to participate in any event hosted by the Institute, primarily because I am a graduate of the Institute, and this is the place where I felt all of my learnings on campus materialize and made sense. It was also the place where I realized what my career choices should be. So let me just give you the state of play from the private sector point of view. My focus, as Dr. Scooby indicated, is on private sector awareness of the climate change health nexus. I must admit that pre-COVID-19, climate change was the focus of roughly 20% of TTCSI's membership. Now, in order to give you some idea, I need to get into who exactly is the TTCSI. The TTCSI is an organization that was established back in 2006. For those of you all in international relations, international trade would know that back then, CARICOM was getting ready to negotiate the economic partnership agreement with the EU. So there was a body that could negotiate on behalf of the manufacturers, but there was no single body to negotiate on behalf of services. So a decision was taken by the heads of governments of CARICOM to establish CSIs throughout CARIFORUM states. So this year we are celebrating our 15th anniversary. TTCSI is the most vibrant and largest CSI in the region. We roughly represent 56 services associations, which translates into roughly 650 companies and individuals. So it's a large scope. We have chambers of commerce as our members. No individual company could join the TTCSI, but rather associations. So we have as our network a sister associations throughout CARIFORUM. So as a researcher, how do I get here into convincing you all that the private sector is concerned about the health crisis and climate change? As a researcher, the first thing that I did is we conducted an economic impact assessment back in May of last year. So I will share with you some of the findings because the private sector becomes involved and concerned when it is impacting their bottom line. So I'm going to talk a little bit about this economic impact assessment that was conducted way back May of last year. TTCSI collaborated with the Manufacturers Association to conduct this survey. We had roughly 394 companies participating. The purpose of the survey was to determine the effects of the pandemic with respect to the hours of operation, dismissals, cuts in wages, decreases in sales. These can be used to estimate the overall economic impact on the country as per sector. Secondly, to look at the innovative mitigation coping strategies that were being implemented by firms. This can be used to make recommendations to other firms or even to policymakers. And thirdly, the post-pandemic business outlook. This is important to gauge the economic recovery and to develop programs to meet the needs of specific sectors that we felt were being hardest hit. I'll now share with you some of the findings from this report. Again, the study will be made available to anybody who wants the study. So these are two of the graphs. The graph on the left shows that roughly 36% of businesses terminated full-time employees and 54% of businesses terminated part-time or contractual employees as a result of the lockdown. The termination of these employees have had negative consequences on Trinidad and Tobago's economy, on employment, poverty, quality of life, and standard of living. For companies who did not terminate staff, 57% asked their staff to take vacation leave. Among these companies, 67% furlough at least 25% of their workers, comprising of both full-time and part-time employees. Furthermore, those employers who did not terminate staff, 46% of these resorted to a reduction in wages. Termination of full-time employees by sector is reflected in the graph on the right. The survey results reveal that most workers terminated were from the services sector, arts, entertainment and recreation, hospitality sector, food processing, food and beverage, and the construction sector. Roughly, the services sector represents 60%, contributes 60% towards the GDP of Trinidad and Tobago. Now, let's look at the impact by sector. Businesses operating in the professional, scientific, and technical activities industries have had to downscale their operations. Physical offices remain closed over this period, and the majority of staff were working from home from May to about December of last year. The urgency to continue operations have forced some businesses to adapt to the age of digitization, and many companies have been forced to implement work from home policies to manage their staff. Again, in the Q&A, there have been some silver linings for us, specifically the services sector. And let's stick a pin on that. Although this resulted from a crisis, it may prove to be beneficial to companies and may even result in lower operating costs and overheads. Animators, one of these sectors that have been able to pivot, they have noted that because their business is digital in nature, they welcome the move to a full digital platform, which is vital to the growth of this industry. The education sector was another area that was able to grow at a small level. Again, there is need for a full digital transformation of this industry, specifically when we're talking about export of education services. All right, so let me just go into a breakdown of termination by sector. Once the sectors that have been heavily impacted, cultural and creative industries, tourism, cultural and creative, sporting, they have seen a cancellation in performances, sporting events and trainings have been halted. Tourism, personal care and services, personal care services. According to the United Nations, the COVID-19 pandemic will result in a contraction of the tourism sector for the next 5 years, specifically on small island developing states. Many local businesses in Trinidad have recorded little or no revenue during the lockdown. Due to the nature of their operations, their only option has been cutbacks in spending and laying off staff. For others, keeping customers engaged through social media platforms is their only means of operating under the pandemic. Now, in closing, in 2021, as a result of the pandemic, which many have argued resulted from climate change and failing health systems, without a doubt, one of the core challenges impacting businesses globally. Another challenge that we are facing in the private sector is that for too long, climate change and trade policymakers and the private sector have been operating in distinct silos. But the fact is that the business trade impacts the climate, and this calls for a more sophisticated conversation amongst trade, policymakers, and the private sector. One of the silver lining is that we have been seeing Caribbean integration as a result of the pandemic. And what I'm talking about is whereby we have seen health, and let's look at one sector specifically. There is globally, the health and wellness sector is the fastest growing sector globally. We have been seeing whereby joint ventures amongst Trinidadian firms, service operators in this sector with Grenadian firms. So there's areas for us to collaborate and establish more rigorous and more robust companies that could lead to some growth internationally.
Ms. Guyadeen, you have like 4 minutes left.
Sure. The private sector is fully aware that healthy employees are more productive. And by this regard, more emphasis has been placed in terms of the well-being of employees. And as again, I am saying that we represent 56 associations, and these associations have been coming to us to help them develop health, mental health packages for their resilient policies for their employees. So there is a much more rigorous drive by the private sector to look at the health and more specifically mental health issues of their employees. And it's not just Trinidad and Tobago, it's throughout the region. However, I will not bury my head in the sand and tell you that this awareness by the private sector will lead to change. There much more has to be done. The answer lies in a different type of engagement. We need a hands-on, practical approach to engage all key parties. This is a step towards meaningful change. Thank you.
Thank you very much, Ms. Guyadeen, for that presentation. It really brings home to us the importance of a whole sector that's really important in our region. That's the service industry sector. So many of our small and medium businesses are being affected, have been affected over the years by climate change, and now, as you quite rightly mentioned, by the impact of COVID. And I was particularly heartened by those positive silver linings that you mentioned when you spoke about how businesses are adapting to COVID and how that may even assist some of our service industries going forward. Particularly interested as well in your closing comment on the importance of a hands-on practical approach where all stakeholders are involved. And as somebody who specializes in governance, sometimes that's the missing link, isn't it? Because sometimes the scientists tell us what needs to be done, and we know, but the governance of making it happen sometimes is the challenge for us. So I'm glad that you mentioned that, and I hope we have some time in the conversation that follows as well to discuss some of these points. We have our last panelist now. For those who've joined recently, welcome to this panel discussion on achieving the SDGs on health and climate change in the Caribbean, challenges and opportunities, hosted by the Institute of International Relations here at the University of the West Indies, St. Augustine. And we're happy to have this panel of eminent experts of the region bringing to bear their particular areas of expertise and knowledge on issues related to health and climate change. And we now have our last, but as we said before, not least, panelist, Professor Donald Simeon, Director of the Caribbean Center for Health Systems Research and Development here at the University of the West Indies. And Professor Simeon is at the Faculty of Medical Sciences at the University of the West Indies. We know that as well he's a chartered statistician, and fellow of the Royal Statistical Society, the UK, as well as a registered public health nutritionist, Nutrition Society UK, and registered nutritionist in Trinidad and Tobago. He's also chair of the Caribbean Regional Hub on the Planetary Health Alliance. He is a professor of biostatistics as well at the Faculty of Medical Sciences here in the University in Trinidad. In addition, and we are going to try to keep his CV brief, so we're only going to spend 20 minutes on this, just joking. He's also the chair of the Research Ethics Committees in Trinidad and Tobago, a member of the National Stem Cells Ethics Committee, the Bahamas, and the Research Ethics Committee of U.W.I. And he's the founding executive member of the Bioethics Society of the English-speaking Caribbean. So I would now ask Professor Simeon to take the floor. He's going to lead us through some of the issues related to the interconnectivity between health and climate change that are particularly relevant in our local Caribbean context, as well as the regional awareness of some of these areas of connection, especially between the government and the private sector, levels of preparedness, best practices, etc. So without further ado, thank you once again, Professor Simeon, for joining us in this panel, and the floor is yours.
Good afternoon, and thank you, Dr. Scobie, for the kind introduction, as well as for the invitation to take part in this panel discussion, which I found very educational. I have learned a lot, so I really am pleased that that I was invited and I was able to attend. This afternoon, I'll be spending the next 50 minutes or so looking at the impact of climate change on health, some level of the regional awareness to the impact of climate change, the partnerships that exist. We have heard about quite a few already. And I'll spend some time on the recently established Caribbean Planetary Health Regional Hub. And then I'll end with just some thoughts on the way forward. I must start by noting the important initiatives. Of course, one of the most critical ones is the establishment by the United Nations of the Intergovernmental Panel on Climate Change, the IPCC, which was created to provide policymakers with regular scientific assessments on climate change, its implications, and potential future risks, as well as to put forward adaptation, and mitigation options. I note that our Professor John Agard was appointed by the UN Secretary General, and he's indeed the winner of a Nobel Prize as part of this IPCC. I also would like to also point out, it was presented before, I think it was Dr. St. John who spoke about the third global conference on climate change and of health and climate change, with focus on the small island developing states, which was hosted in Grenada. So we did have an international event on climate change here in Grenada, and we thank Dr. St. John for bringing it to the Caribbean. I also would like to point out that there is an excellent operational framework that for building climate change resilient health systems that was also developed by the IPCC. So what are the impacts really of climate change on health? There are direct impacts arising from injuries and illness due to increased frequency and severity of extreme weather events like hurricanes is the most important one for us in the Caribbean. The impacts of climate change on health are also mediated through environmental systems such as rising air pollution and the changing patterns of vector, food, and waterborne diseases. And they are also mediated through our social and human systems, such as the health effects resulting from undernutrition, occupational heat stress, population displacement, the slowing of economic growth, and poverty aggravation. What is important to note, though, is that the health impacts of climate change are much greater on the vulnerable. It could be defined in terms of countries. Small island developing states, would have a greater impact than the larger countries, but also even within the SIDS, the poor, the children, the elderly are the ones who feel the effects of climate change the greatest. In terms of direct effect of climate change, the effects can be due to an increase in the number of very hot days, the UV radiation, number of bushfires, Sahara dust, and some of the risks, health risks associated with such climate effects include excess in heat-related mortality, exhaustion and heat stroke, particularly among outdoor laborers and the elderly. This issue of workers was just discussed by Ms. Guyadeen. Also, risks for health include exacerbated circulatory, cardiovascular, respiratory, and kidney diseases, and increased premature mortality related to the ozone and air pollution produced by bushfires, for example. And the impact would include increased injuries, cancers, disease, and death. Looking at the effects that are mediated through environmental systems, these are due to higher temperatures and humidity, changing and increasingly variable precipitation. We have an increase in floods as well as droughts. I mean, we know what's happening in Trinidad and Tobago. For this season, we are supposed to be in dry season, and we heard about so many floods that occurred in February and March, which is, unprecedented here. And critically, there also the issue of the higher sea surface and freshwater temperatures, and the health risks associated with this range of climate change effects include accelerated microbial growth, survival, transmission, and virulence. Also, shifting seasonal distribution of diseases, the lack of potable water leading to poor hygiene, and of course the associated diseases, damage, contamination of water sources, accelerated parasite replication, and increased biting rates by insects, mites, etc. Prolonged transmission season, the re-emergence of diseases, increase in disease vectors, and reduce effectiveness of vector control. The health impacts include increased food and waterborne diseases, as well as vector-borne diseases and zoonosis. I know that Dr. St. John had pointed out that COVID is a zoonosis, and of course it is felt that it came from animals and jumped to humans. And the third area for health effects are mediated through the human systems. And the climate change effects include higher temperatures and humidity, changes in precipitation, rising sea levels, which result in loss of land mass, relocation, and impacts on the economy, tourism, etc. Health risks includes lower food production, critically, lower access to food due to reduced supply and higher prices, leading to the combined effects of undernutrition and infectious diseases, stunting and wasting in children, and outdoor workers either work in unsafe conditions or they lose income and, of course, livelihood opportunities. Health impacts include increased undernutrition, as well as the consequences on workers' health, loss of work capacity, reduced labor productivity, etc. This is a nice figure. I don't want to spend too much time on it or hope it does not confuse you more. I mean, at all. But what I want you to focus on is the circles in the middle of the the three segments of the figure. At the top, there is a figure with a brown circle, and there are some arrows leading from it. And there's another one to its right. The one at the top says present. That's actually, this was prepared by the 5th IPCC meeting, and this was from the health chapter of the report. And the circles in really measure the size of the global disease burden due to climate change. So if you can see in the one at the top at present, 2015, we can see the size of the burden when you go to the right of it, which is 2030 to 2040. This is projected, of course. You can see the size of the burden increasing, and then below to the left, we can see what is projected to be in 2080 to 2100. You can see the big increase in disease burden. Looking at it a bit more, we can see the different types of effects, and the effects include we're looking at disease, vector-borne diseases, occupational health, mental health, etc. Looking at the one to the right, we can see one of the biggest areas of increases is undernutrition, which of course is particularly remarkable because we are now going through an epidemic of obesity. But if we continue with and not taking the right adaptations for climate change, the effects of reduced food production would really result in an increase in nutrition. And if you look at the 2080 to 2100, again, you see that big increase in undernutrition. But also in other diseases such as foodborne and waterborne diseases, mental health, as well as occupational health. In terms of the Caribbean region's awareness, we note from the presentations, especially from CARPHA and from PAHO, that there are a number of projects across the region that focus on mitigating and responding to the challenge of climate change. We are very pleased for that. And of course, those initiatives address issues like vector-borne, foodborne, waterborne diseases, sargassum seaweed, Sahara dust, poor air quality. But I really believe that they tend to work too much in silos, and there's a need for greater intersectoral, interagency planning, implementation, research, and evaluation. I note, having said that, that there are a number of agencies that collaborate on these projects, but I'll talk some more about what I mean by, a greater need for this intersectoral work. There's also a greater need.
Simeon, you have 4 minutes left.
For greater communication of the threat and required response. And we also know that there are surveys being conducted to measure awareness of climate change in the region. There are some partnerships. The One Health projects by Professor Ora was very successful, the number of partners, and the current EU CARICOM Strengthening Climate Resilient Health Systems in the Caribbean. That project has a number of collaborators as well. And I would spend a minute on the Caribbean Planetary Health Regional Hub. And planetary health was not introduced before. It is the health of human civilization and the state of natural systems on which it depends. The Caribbean hub of the Planetary Health Alliance was established last year to serve as a regional leader in planetary health by generating and disseminating knowledge, building relevant skills, and creating public awareness and behavior change, which is to be accomplished through research, education, training, outreach, and sharing transferable solutions and policies across the region. The vision, our vision is safeguarding optimal health for the Caribbean people and Earth's natural systems. And our mission is to build an active, collaborative, interdisciplinary planetary health community of practice to inspire, influence, and guide Caribbean people to tend and protect ecosystems through policies and programs for sustainable and regenerative outcomes. And some of our strategies are to build a diverse and collaborative planetary health research community, an agenda that includes the development of innovative solutions that inform policy, define and build region-wide planetary health education and training programs, develop systems, processes, resources to support collaborative research, education, and communication, and to generate awareness of and demand for planetary health resources from the general public and policymakers, and to develop a long-term model of operation and funding for the hub. Okay, I will jump to the way forward. So climate change and health, I want to distinguish between programs as opposed to projects. We have a number of projects, but I really believe that they should be driven by a program. It is very good that one of the strategic priority areas in the new CCH4, the Caribbean Cooperation in Health, the 40th edition, does include climate change. This is, of course, excellent, and we really need that to be the basis of all the climate change and health projects or activities that are conducted in the region. And the whole issue of true partnership between regional and international actors, really, that has to be properly defined and addressed. And more so, what is the role of the countries in terms of supporting and implementing what the regional international actors talk about? U.W.I, we talk about one U.W.I, but I don't know how much Professor Agar, Professor Aura, the group in Jamaica, and even my center, how much we work together. We really need to work a lot more as a U.W.I body to address the whole issue of climate change and health. The other question I have too, perhaps more questions and answers, is have there really been very successful health interconnection models that we can use? NCDs, we have put forward the Port of Spain Declaration, HIV, there is PANCAP, COVID, a lot of collaboration among different sectors. Are there models there that can be used for climate change? And I must end by talking about research. I think it's important that we really define a research agenda to really drive the climate change and health work in the Caribbean, in Trinidad and Tobago. This has to be defined with input from all the stakeholders. Of course, funding is always critical, but I always wonder about these large projects, 100 million here and there, and no research, budget line is there. So those projects, I believe, should be used to fund research to really identify what are the issues and, of course, the solutions. And, of course, the whole issue of capacity to do the research, and which I believe rests to a great extent on collaboration. So I will end at this point and hand back over to Dr. Scobie, who is the chair of the panel discussion.
Wow, thank you so much for that fantastic presentation, Professor Simeon. Congratulations on heading this important project, on really helping the region through these health-related issues. I particularly found interesting your comments on the importance of collaborating more closely. It is a challenge. We're a small region. There are many issues to be addressed, especially related to climate change. and those issues mean there are many stakeholders involved, and collaborating effectively between and among us is a challenge. You know, I also found very interesting, it's something that I focus on quite a bit in my own research, your comment on the need to move away from projects to programs. You know, some projects end and have a close date and the funding ends, and as great as the project is, sometimes the sustainability isn't there. And I'm very happy to hear you as a health professional speak of the need to move towards programs that are certainly more substantive in terms of their longer term application, which is what as a region I always argue we need, you know. And so we've had a fantastic, those of you who've joined us recently, welcome. We are at a panel discussion hosted by the Institute of International Relations on achieving the Sustainable Development Goals related to health and climate change in the Caribbean. And we are looking at the challenges and opportunities. And we've had a fantastic panel of Dr. Joy St. John from CARPHA, Dr. Taraleen Malcolm from PAHO, WHO, Ms. Vashti Guyadeen from the Trinidad and Tobago Coalition of Service Industries. And last, we heard from Professor Donald Simeon, Director of the Caribbean Center for Health Systems Research and Development. And we have had a very active chat happening in the background. And I'd like now to highlight some of the comments that were raised in the chat, as well as one or two of my own, after which I would like to ask the panelists to consider responding to those that they think resonate most with them. And also to, if you have any comments or questions for your fellow panelists as well, we'd be more than happy to hear from you. So just a taste, a flavor for some of the questions that have come up in the chat. You know, Ryan Abraham, for example, asked about what are policy or management options are being undertaken to strengthen climate resilient health systems, especially in the context and given the impact of COVID-19. And that's something that I'm sure many of our panelists work on from on a day-to-day basis. Sharian Bachan asks, how prepared was CARPHA to respond to COVID-19 based on past responses to health threats like the Zika outbreak, for example, which probably provided a good platform to help us to respond. Related to that was there an adequate response? This is another question. Or what do we think about the response that CARPHA had during the Zika outbreak to present the spread of diseases, and maybe what lessons were learned from that in terms of detection, prevention, and control measures? Alyssa Ali asked about thinking about some of the main obstacles creating effective climate health policy for the region, and what are some of the recommendations. I think some of the panelists spoke about, you know, precisely troubleshooting to recognize what these obstacles were, and I guess your day-to-day job is precisely working to overcome some of these obstacles. But maybe you could reflect on maybe one or two that you consider perhaps most prominent. And Brittany Peters asks, what are any positive outcomes from working from home in relation to climate change and health? And I think that was more directed to the service industries perspective, but perhaps others may also like to reflect on that. Finally, we have Sumir Sukhdeo, who asks, should we continue to exploit our resources, speaking about deforestation, wildlife trade, etc.? I guess the answer to that would be no, but are we doing enough to address these environmental stressors in the context of climate change? And very thought-provoking question is, are we ready for another pandemic? Well, we're not out of this one yet, but I guess reflecting on what we've learned so far in terms of our preparedness for something further. And well, these are all interesting points that we could look at. I also would like us to reflect a bit upon, we as a Caribbean people, we have local communities, we have a lot of social capital in many cases. And I would like each of you to reflect on maybe one or two examples that you've had from your own work over the years, where community action has been involved in helping address some of the key areas of focus that you've had as organizations, centers, groups, etc. So that's quite a mouthful, but I see all my panelists taking good notes. So I think that I'd like to ask you to speak in the order in which your comments were made. So that would be first, Dr. St. John. Would you like to comment on any of those questions? Or the last one I had about community action and health?
Oh dear. How much time do I have? Well,
Putting you on the spot. That's a very good point. So can I ask you to keep your comments to just about 5 minutes? So, and then maybe
that's
that
too
can
much
lead us to
time. Anyhow, let me start first with Sherry-Ann, who is well known to us. I'm trying to find her questions because they were very specific. Oh, here we are. I am not sure if Zika could have prepared anyone for what COVID-19 has done. But I will tell you some of the constructs that were used in Zika, which are currently used for COVID-19. The first thing is that CARPHA is part of the security cluster of CARICOM. And in November 2019, we actually met and raised the level of threat of pandemics or outbreaks in the risks and threats table that we have for the CARICOM region. We didn't know about COVID-19, but we knew about the impact that a pandemic could have. And so the first construct was that we're part of the security cluster of CARICOM. The second construct is the Regional Coordination Mechanism for Health Security, which is a mandate given by the heads of government some years ago, not in response to Zika, but in response to chikungunya. And we use that framework to convene sister public health agencies, including ones like the one for France, the one for the Netherlands, and so on. And we had a policy directive, therefore, at the technical level, because it also included member states, for a way of working with this. There was a construct left over from Zika, and that was the strength of surveillance. And in the way that there was surveillance for neurological symptoms and also for microcephaly in COVID-19, we have had surveillance, interestingly enough, for MIS-C, that condition that affects children who have had COVID-19. And that has been an initiative of one of the members of the expert advisory group that CARPHA convened to give advice on COVID-19. So the construct, I think, that worked the best for what has happened in the region with COVID-19 is the functional cooperation in health. But in this regard, the chief medical officers were the core group that we interacted with. And we talked to them daily through the WhatsApp group, telling them, keeping them up to date with what is happening. But the most important thing is that they talked to each other. They told each other about what they were experiencing, what worked, what didn't work. If there were protocols that they needed, they shared. And that functional cooperation in health really has shone more so for COVID-19 than I think for Zika. So I am not sure about the totality of the CARPHA response during the Zika outbreak from an internal perspective, because I wasn't working with the organization at that time. But any gaps that you may have perceived are being filled by that EU project. and the way in which CARPHA is interacting with the member states. They dictate what they need under the headings that I would have shown you in my slide. Now, in terms of an impediment to effective action against health and climate change, it is first that not everybody knows that there is some effect, direct effect or indirect effect of climate change on health. Some people go along blissfully thinking that climate change is an esoteric concept with no impact on their daily lives. And so translating that understanding among the health sectors, the economic sectors, and the general population, I think is one of the biggest barriers. And then the other barrier is the lack of resources that we have specific to the action on climate change and health. Now, I hope that's 5 minutes because my voice is failing. All of this Sahara dust has me in trouble. But if it is up 5 minutes, please say it is 5 minutes.
It's 5 minutes.
Good, thank you. Bye-bye. No more talk.
Thanks very much. That's a good reflection, and I think we couldn't not link the existing challenges that we've had in the region previously on health. So I'm very happy for that question, and the way you've linked the response to Zika, mentioning particularly how the chief medical officers have worked together. I think that's fantastic, and it's one of the strengths of the region. Although we're small, we come from many communities that can together contribute precisely in functional cooperation. So thank you for that. Before I pass the floor now to our second panelist, Dr. Malcolm, I just want to highlight a question from Peter Murray from the Caribbean Regional Fisheries Mechanism. And he is asking Professor Simeon about the extent to which research areas would include things related to the interface between marine ecosystem health and human health. Everybody knows Peter Murray is an avid proponent of regional fisheries and the impacts on and the relevance to our regional communities. And I think we really are very grateful. Thanks, Peter, for that question on the links between marine ecosystem health and human health. So now, before let's move on, give Dr. Malcolm an opportunity to address some of these questions, or maybe questions or comments that you have to your other fellow panelists. Thank you.
Thank you, Dr. Scobie. There are two main ones that I would like to respond to. The first one spoke to what plans or management systems that are in place to help to strengthen or build resilient health system, especially in the context of COVID-19. And what the pandemic have done is really highlight the vulnerability of the health system that we have in the Caribbean. And it also showed the fragmentation in the system. And to some extent, we have recognized that the health system in the region, in the Caribbean, is sometimes disease-oriented. So you have your specific clinics days for diabetes or hypertension, but that integrated approach to managing the health and well-being of an individual in some context is a bit missing. So what the pandemic have done is really highlight those vulnerability within our system. So why at this point in time, the countries are still in that response mode, trying to respond to the pandemic, trying to roll out the vaccine, but at the same time, in an effort to maintaining those essential function health services. The plans and the systems, I believe, are in place in terms of Dr. St. John mentioned about the Caribbean Action Plan on Health and Climate Change. Professor Simeon mentioned about the framework, the operational framework for building resilient health systems. So those are in place. I think the issue then is how do we utilize that intersectoral, multisectoral approach to facilitate the implementation of these actions. And then Dr. St. John earlier mentioned about financing, which is one of the areas that I believe is one of the hindrance to some extent in being able to implement. Professor Simeon mentioned the whole importance of us. There are a lot of projects being done, but how do we transition from projects to program? And again, that is where the whole system, the finance system for health and climate change is so important, because many times we tend to get funding for a specific project, but how do we use those projects to build that institutional framework within countries to be able to advocate locally for a national budget to respond to health and climate change, while at the same time being able to approach partners who their focus may not be on health, their focus may not be on climate change, but how do we advocate, how do we relate with these partners to get these partners to start focusing on health and climate change, showing that link to all the different sectors. We can see the link to education, we can see the link to national development, we can see the link to the economy. So how do we get the funding agency to start putting fund in those areas to allow countries to build that institutional capacity to be able to integrate the health and climate change within their national system? So that's the first one. The second one was as it relates to how do we engage actors who are involved in health and climate change to look at health indicators that are relevant, and looking at whether or not they're the link between NCDs, for example, and sustainable agriculture. And that is really a good question to put on the table, because we do know that climate change is impacting on agriculture. We know in terms of flooding, we know in terms of drought, we know how that is impacting on agriculture. And if we're unable to have sustainable agriculture, we are also having the NCD epidemic. We're having the problem in terms of obesity, because persons are consuming food that are highly processed and have added sugar and salts and all these nutrients that are impacting on their health. So it is important to really have, and it brings us right back to the discussion of that One Health approach. It brings us right back to ensuring that we do have all the different players sitting at the table, coming up with the initiative, including the indicators in terms of monitoring and evaluation, because these links are so intertwined, and one impact in one area is significantly impacting another area.
Thank you. The challenge of the interlinkages between climate change and the rest of the SDGs, and also the interlinkages between health and the rest of the SDGs, is something that really came across quite poignantly in what you've mentioned, Dr. Malcolm. So thank you for that, and thank you for linking what Professor Simeon said to what some of the things that Dr. St. John said about precisely the importance of working through these issues together at the regional level. I now would like to pass the floor to Ms. Guyadeen, also asking, and I'll get back to you, panelists, don't think you got away from answering the question about what about the grassroots community and how have they contributed, or is it something that it hasn't permeated to our grassroots yet, the question of climate and health? So, Ms. Guyadeen, would you like to address some of the questions that were more directly related to the service industries?
Yes, I think one in particular, that question was from Brittany with respect to the economic impact assessment study, where she asks, were there any positive outcomes from working at home? And Brittany, what I would like to say is yes, there has been, it's not just simply working from home, but more so working virtually, where we have seen where service providers, and specifically I'm talking about the business and professional services sector, where I have had companies, consultants tell me that how COVID-19 has had a positive impact, meaning that they were able to bid on projects and win bids simply because they did not have to travel. So that means pre-COVID, they would have gotten 1 or 2 contracts, but last year they were able to get 6 contracts because there was no travel time and all the delays in terms of traveling to and from a destination. The animation sector is one of these sectors that have had some increase simply because the impact on the animation sector in Europe was so severe that most of those animators were out of commission, and we have had where Caribbean animators were able to pick up that slack. Another aspect in terms of there has been some negativity as well in terms of there are no longer any boundaries. And what we need to do is set some boundaries. What I mean is that this work from home, working remotely, it means there's no cutoff. You are working longer days. And firms have now said that we need to establish some type of structure. If I'm working from 8 to 8 p.m. or there needs to be a distinction between working hours and leisure time. So that has had impact on family life as well. Now, getting back to community and the grassroots. Dr. Scooby, I will have to say that because services in Trinidad, most of the associations, because we represent, I'm talking about, so we have the sophisticated, the more mature services, financial, the business, insurance, but as well we represent midwives, the personal care, the beauticians. And I have to say that those persons operating at the grassroots level, they are very conscious of the impact on the climate. I'm talking about tour operators. They know about the impact, sea level. They are very conscious that what that is going to do on their livelihood. So much so they have reached out to us to engage the more established businesses to get some financing to assist with work in those areas. What I would also like to point out is that an area that we have not seen any focus on, there is a website, COVID-19 Innovations. And we have been trying to get associations to talk to each other because we have seen where globally the architects would get together with the planners, the realtors, because now there is a drive that malls, all these shopping malls need to be reconfigured, whereby you would have now malls and now condos. They have flats, but we have not reached that level in Trinidad and Tobago and indeed the Caribbean, where we have associations talking to each other to innovate and to find new forms of doing business.
It's very interesting. Thank you very much for that, Ms. Guyadeen. Really very interesting. And I think that hopefully with the help of your coalition, we'd be supporting some of those persons at the grassroots level in their attempt to, as you say, innovate with the new normal that COVID has brought to the climate change health challenge that we face. Professor Simeon, I would like to pass the floor over to you now. Before I do that, though, I would like to mention, in addition to Peter Murray's comment and question, we have 2 others. One from Ben Mirage, asking about the obesity crisis, and if you could comment on whether Caribbean populations face challenges regarding micronutrient deficiencies, that is like hidden hunger. And is that linked in any way to the climate variability challenge that we're facing as a region? And then more general question from Ibrahim Abdullah, or comment rather, on the Green Spaces program and what that can do for both climate change adaptation and mitigation, as well as for health. And Professor Simeon, I'd also like you to to think about, if you could think about from your own experience, any ways in which the grassroots community groups have engaged on climate change and health issues for our region. Over to you, Professor Simeon.
Yes, thank you, Dr. Scobie. I also saw a very interesting question from Alyssa Ali, in which she asked about obstacles to creating policies to address climate change. And I would start with that one because when I saw it, I told myself that the challenge wasn't about creating policies, it's really implementing the policies, evaluating the policies to see if they are impactful, and of course making the relevant changes. But then I said, no, that was the wrong answer, because the right answer is that the process by which policies are made, really needs to be reconsidered. Being the director of a center that addresses health systems and policy, we have studied this. And what we note is that the engagement of the same grassroots communities that you mentioned, tend not to be part of the policy-making process. That is a big part of why some policies don't work, because they don't really ensure that the persons who are affected by the policies are part of the process to make the policies. The other critical reason why some policies, are not as successful as they should be is because they are not really evidence informed. The research that is needed isn't there. When we ask them why, they would say that the researchers, didn't let us know what research they were doing. So of course, there is this challenge between researchers and policymakers who don't speak to each other. But there has to be such a conversation to ensure that when policies are made, the evidence is actually informing what is there. If those things are in place, the chances of more successful policy for climate change and other health-related issues, would totally be more successful. So that was a question I wanted to just comment on. Peter Murray, yes, speaking about the marine ecosystem, we live on islands, and the marine ecosystem is critical to us in so many ways. We talk about climate change and the increase in sea levels. Sea warming, the impact on mangroves and beaches, what that would result in, the Caribbean as a whole, is dependent to a great extent on tourism. We are about sea and sand, and if there's no sand because of rising sea levels, what is the impact on the economy, on poverty, income, and of course, disease, so there is a very strong link. But Peter Murray did raise the issue about research, though, research agenda, and I really welcome, the marine biologists and persons who work in that sector to collaborate, because we all have to work together to really ensure that we develop a research agenda for climate change that includes all the different components, whether it's agriculture, whether it's health, whether it's the marine environment. We all have to come together to develop a research agenda to really ensure that we have the evidence, again, to inform the same policies that we need to address climate change. Then Maraj asked the question about, in the midst of the obesity epidemic, if there's a hidden micronutrient unseen epidemic as well. And that's a very important question, because if I were to wear my hat as a nutritionist, we recommend 5 servings of fruit and vegetables per day per person. Surveys have shown that 10% at most of the population is actually consuming that. And the reasons people give is that the fruits and vegetables are not available. We know the importance of flooding, droughts on the production of vegetables. So that link is definitely there, and the fact is that even though we haven't done the number of micronutrient surveys to see what is the prevalence of, let's say, zinc deficiency or calcium, etc. But we do know that people are not eating properly in terms of the fruits and vegetables, and that we know results in micronutrient deficiency. And we also know that, as I said before, you know, the whole issue about agriculture being affected by climate change is real. You know, I mean, just last month here in Trinidad, you know, there was farmers down in south complaining about, you know, their fields being flooded out and therefore they couldn't get their produce. And what that meant, of course, is that the price of vegetables go up, and the people who should be eating it, vegetables, are not really consuming it. So ending up with the micronutrient deficiency. So yes, so there really is a very strong link there. Regarding the community engagement, I I note that the One Health project was very effective in engaging the community. That was a project that was led by Professor Chris Ora. And they did a number of projects by engaging the grassroots, you know, in the whole climate change, you know, well, that was about One Health, you know, but it was very consistent with the climate change issue. So I think that engagement was there. And it's important for me to also point out that the last 3 days, I was involved in conducting interviews for a climate change and health leadership project in which we were interviewing what the 11 candidates from across the Caribbean about, you know, why they want to be why they want to be fellows in this program. And one of the questions that we asked them was, you know, their involvement in grassroots projects. And it was really interesting to hear the range of projects that they are involved in throughout the Caribbean, in the grassroots projects that address climate change. So it is happening. We don't see it, but it is happening. And we really need to identify the so-called good practices and really highlight those and encourage those, so that we can have, you know, more grassroots involved in addressing climate change. But my last point, though, is that it's about education, really. I think that is perhaps a missing link, not the missing link, a missing link in that people don't appreciate, you know, what climate change and the health impact of climate change. People don't know. You really need to get it out to the grassroots so that they can appreciate it and, of course, take the action because they are willing. When you hear people describe their grassroots project in climate change, you know, you're amazed that people, you know, can do it and they want to do it, but of course they need the support. So those are my 5 minutes of comments.
Well, thank you very much. Thank you very much there for those comments, Professor Simeon. I think what you've highlighted there at the end, which is the sort of agency of the grassroots, you know, in their own activity. Sometimes it's the hidden but very active role of the people within the community that solve many of the immediate impacts of climate change on health. And to highlight some of those best practices would be very useful. And I think that's a fantastic project that you're engaging in to do that. We have time for one more round of comments. I'd like each of the panelists to reflect a little bit on maybe on one or two things that you'd like to comment on quite briefly. Particularly, I would like to ask you, as the persons responsible in each of your agencies for issues related to climate and health, if you had all the resources possible, or if you had the ability, what would be the one thing that you would say would be lacking in our region and that you would identify as the thing that's most important to achieve better coherence between climate change and health, to solve the impacts of climate change on health? So if you had that power, what would be that one thing that you would say is perhaps the most important for addressing climate change and health from the perspective of your organization or agency? I say that because as a person who works on governance and governance in the Caribbean, environmental governance in the Caribbean, we often have a long checklist of things that are all very important. And while that's true, I think you guys sit at an excellent position to be able to probably put some priority in that long checklist. So sorry for putting you on the spot.
Okay, so if I were to go first here, I'm sorry, but I'm having a little bit of connectivity issues here. So I would like to go back to Professor Simeon's point, and I would have to respectfully state that how at the grassroots level, specifically I'm talking about the grassroots that I have been in contact with for the last 3 years since I've been in this position, they have a significant regard for the climate. It's just that we are not listening to them. So my superpower, if I were to, is that we need to break down the barriers amongst the different stakeholders, academia, private sector, civil society, and actually listen to each other. Because the grassroots, specifically in key communities in Trinidad and Tobago, are fully aware of what we are doing. Fisher folk, for instance, they have a high regard for the ocean, but we are not listening. It's probably not the language that we are accustomed to understanding, but we need to sit down together and work out. There has to be, as I said in my closing, it has to be a different approach of doing things. And we need to not feel that we know everything. There are things that we could and we will learn from them. So that's my way forward.
Thank you. Thank you very much for that, Ms. Guyadeen. You did mention at the beginning that you may have some connectivity challenges. So very happy that you managed to stay with us for the entire session. And thanks for those comments. Should we pass the floor now to Dr. St. John?
I have to say that it isn't just a matter of listening. It's a matter of taking their advice. Our grassroots communities are very in tune with their environments. And they are also seized of the traditional folklore and history passed down through the generations. And they very often give extremely good advice. We have to realize that even if we may have training and experience and expertise, that sometimes we have to stop, listen, and obey instructions, even if they're coming from someone who might not be an executive director or professor. The other thing that I think that I would like to say is that we need to have respect for the space from which grassroots, traditional healers, etc., come from. And what we're doing to the planet is driven by greed and a lack of respect for others. And in grassroots communities, small villages scattered across the CARICOM region, that respect for your fellow man, looking out for your fellow man, living as a community has been elevated to a high level, an art. And we need to respect that space and to learn the lessons from them. Remember, I spoke about how the strength of the response of the region to COVID-19 is in the community of the chief medical officers and how they share information, not just what goes right, but also what goes wrong. I think we need to be doing a little bit more of that when it comes to issues to do with climate change, especially as how it affects the grassroots persons. Over.
Well, thank you very much for that, Dr. St. John. That respect, that we need to have for all members of the community and the knowledge that they bring to the table and engaging them, listening and also working with them to implement workable solutions. So thank you very much for that. We have about 6 minutes left. We still would like to hear from Dr. Malcolm and Professor Simeon, who you've been addressed several of these later comments mentioned you, so I'm sure you have also some feedback to give on those. But first off, can we ask Dr. Malcolm to share some closing remarks?
Thank you, Dr. Scobie. And just to add to what Dr. St. John and Vashti mentioned, the role of the grassroots and the people in the community. But the barriers are at all levels because the whole silo approach continues throughout. And I can use example where we understand that health sometimes is seen that it rests within the Ministry of Health, even though we know that the determinants of health are outside and beyond the Ministry of Health. Also, in terms of climate and the health of the climate, it's sometimes seen that it is for the Ministry of Environment or the Ministry of Planning. And therefore, health will do their own thing, and the Ministry of Environment or Planning and Development do their own thing. And that is where we always have that problem, where we are not speaking to each other. We're not sitting at the same table. And even though we understand that this is the plan, and as I think Prof said it before, that the plans are developed, but are we using the appropriate strategy or method to get the input of all the different stakeholders sitting at the table together and coming up with the plan in that collaborative approach? And I think that is where we really have to focus where health and climate change is concerned. Getting persons, getting the organization, getting individual to understand. And it leads us back again to the health in all policy and that one health approach, where we all have to understand that health is linked to all aspects of life, all aspects of the country and development, and how responding to the health, whether it's the health of individuals or the health of the environment, how they all impact on overall national development. And I think that is where we really have to get to, getting all these different policymakers to move away from the silo, move away from just focusing on the area that your department or your ministry have responsibility for, and understand the linkages that they play with the different sector. And that is where we will be able to really make a difference in advancing the areas of health and climate change.
Thank you, Dr. Malcolm, for highlighting the importance of removing the silos, recognizing the challenges that we face, but it's something that all of you as experts have highlighted. So I think it's something for policymakers to really try to address, and you as experts to assist them in doing that as well. Last but not least, Professor Simeon, comments from you, please.
Yes, I agree with my fellow panelists that the critical issue is communication and listening and acting on what is being said. But I would propose that we go beyond listening to the communities, to the grassroots, but listening to the planet as a whole. I mean, as I did in my presentation, I spoke about the Planetary Health Alliance, and we have to really look at the signs, the increase in floods and, dry season that is as rainy as it can come, it means that we are doing something to the planet and the planet is fighting back, So I think that listening is something that we have to really look at going forward. But as I said, I really endorse, the whole idea of ensuring that we talk some more, collaborate and come with a common agenda and address it, but as a director of a research center, if I were to have a magic wand and I have one thing, I would say, more research, we really need more evidence to guide whatever decisions that we are taking. So that is an area that should not be minimized at all. Research it's about doing research that is impactful, not just doing research for doing research sake, which is, I think, an issue that the general population has with U.W.I. You know, they see us as people who in an ivory tower doing our esoteric research, you know, and they don't feel it. So you really have to engage with them to really ensure that we have an agenda that suits what they need. And of course, that research will be appreciated by them. And of course, the support to do the research, you as a researcher know the importance of funding. If government, for example, sees, you know, how the funding can really impact on their policies, the support can come from them as well. Over.
Thanks very much for that, Dr. Simeon. You know, words of wisdom, and we really need to find ways to support the areas where we can get this good knowledge from the research, from the community, and as you said, you know, from the earth itself. If we listen, we can hear the signs from them as well. So I'm afraid we've run out of time. We're just on time to end today's session. So thank you to my fellow panelists for your very amazing, fantastic contributions, very thoughtful contributions. We've before asked the panelists to focus on particular areas, and I'd like to congratulate you all for really honing in on those areas, on the issues of addressing climate and health in the Caribbean, looking at some of the challenges as well as some of the opportunities. So Dr. St. John, Dr. Malcolm, Ms. Guyadeen, and Professor Simeon, thank you once again for your participation, for your thoughtful comments in the Q&A afterwards. And we look forward at the IIR to your continued collaboration with us as we try to reach a wider public, to bring some of these issues from the Caribbean perspective to bear to a wider national, indeed regional and global dialogue. Before we end, I'd like to invite you to our upcoming public forum. It's a diplomatic dialogue, we call it. It's going to be held on the 21st of April at 1 p.m. And the topic is the Commonwealth, History and Contemporary Relevance. And we have Ambassador Ransford Smith. He is former Deputy Secretary General of the Commonwealth Secretariat. So looking forward to having you join us again next Wednesday at 1 p.m. for that. Any further information you need, feel free to contact us at the IIR. So once again, on behalf of the Institute of International Relations at the University of the West Indies, thank you panelists, thank you attendees for your very active engagement. The chat has been going at a pace, and I'm sure that afterwards some of the attendees will continue to reach out to the panelists for further conversation about some of these important issues. So thanks once again to everyone. Enjoy the rest of the afternoon, and indeed be safe in these times of COVID. Take care, everyone. Bye-bye.
Thank you very much. Yes, and bye.
Thank you. Bye-bye.
Bye.